Great. So what I wanted to talk about today was in two parts. It should be only like 15, less than 15 minutes. One part is just gauging your opinions and your knowledge of like ethical medical service, especially in the development context. And second of all, like cross-cultural medicine and the ethical issues related to that and how people tend to resolve it and what is, in your opinion, are like more ideal ways to look at issues like that. So the first question I have, what ethical issues do you think one may encounter when participating in short-term medical trips?
What are the main issues that you'll
Yeah, main
encounter?
ethical issues that you think just would arise.
So for medical professionals, I think in my experience, what they've encountered is lack of resources, and probably the biggest one is that when there's a really serious medical issue in the indigenous population, do you treat it when there isn't any follow-up? So if you have a medical mission going into a small village, and you see someone with cancer or some kind of really serious issue, if you give treatment, a little bit of treatment that requires follow up, they're not going to get the follow up. So is it better to do something that's just sort of timely for you know not a whole lot more than what the indigenous people might be able to do
Right.
right there? So I do a lot of work with the American military who go into they do humanitarian efforts around the world, and they face this all the time. I mean, how much treatment do you give?
Right.
And especially when there's follow-up required, because there's just no way that these
Right.
people can get to follow-up.
So what are some ways that people have resolved the follow-up issue, or what's the response to it?
Well, the response is you have to look at what are the resources available within that region and work within that constraint. So, whatever they might be. I mean, there are other issues that, for a lot of places, women are not allowed to give consent for medical treatment
Oh,
without their
interesting.
husband being present. So, for American medical personnel going into an area where that's required, it really hampers your ability to. I mean, sometimes if you don't have any female physicians in the group, they're not allowed to do an exam
Right.
because the women can't be seen undressed in front of a man that isn't their husband. So those are all sorts of issues, and I think they're difficult issues for American medical personnel going in, that they're not used to that, and they haven't necessarily been trained in those kind of cultural
Right.
practices that people have.
So considering these like problems that may arise from just like cultural conflicts, do you even believe that these medical service trips are effective and should they occur?
Well, I mean, at a base level, they're effective in. I mean, I know a lot of missions go in and they're doing. I mean, really basic things like, getting rid of worms in kids,
Right.
giving vaccinations.
Right.
That's actually a pretty effective thing to do. Um, so I think even if it's only a little bit, of course it's effective, and it's probably not just effective for the indigenous people, it's also really helpful for American medical personnel to be able to understand the the issue at hand. I mean, they sort of learn something. If you're in Nepal and you're learning about indigenous medical practices in Nepal, that's actually really helpful for American medical personnel. Even if it's prayer, something that's non-medical, but it's sort of integrated into their way of healing, that's something really interesting for American medical personnel, because we don't cover anything like that in medical school in this country at
Right.
all. So
Right.
there's always kind of give and take between the two. But I think that we learn as much as we give.
Right. So I think that's like been an argument that people definitely have brought up, but also a concern that people do bring up is like in terms of short-term medical service, especially since there's no follow-up, what medical trips are doing may actually be more detrimental than they are beneficial. What's your take on that?
Well, how would they be?
In the sense that there's a surgery and there are complications
Yeah.
following it, and you couldn't
And
follow
that's
up
why
on
I'm
it.
saying I think there are times when
Right.
maybe it's not the proper thing to do to
Right.
perform a surgery, which is horrible because the patient may die. But do you want to leave someone who's in a debilitated state and there's no follow up and nobody knows how to treat
Right.
the follow up care? So
Right.
sometimes you do have to just kind of step back and do.
Right. Another example I'm thinking of is maybe not as complicated, but maybe a bit more complicated actually, in terms of like if you provide fever reducing drugs, and then when people maybe the locals don't really have as much knowledge of acetaminophen or stuff like that, and just believe that it's a drug that cures illness or cures sickness, and then you develop this more like idea that's not true, which I think is what some activists who are anti short-term medical trips have been saying. Do you feel like this is a valid concern,
I
or
don't. I really don't. I think that, part of a good medical team that goes into a community is working with, hopefully with a translator as well, to helping people to understand, here's exactly how you use this prescription or whatever it is that you're going to give to the people. And I can't say that there's any harm with that.
That's fair. Do you have any like suggestions for what, like you were talking about a good medical team?
Yeah.
What would that look like to you? You talked a little bit
Well,
already.
I think it has to be really balanced. So for one thing, I mean, you have to think about what country you're going into. If it's a country that, again, has issues about women not being able to be treated by men, that has to be taken into consideration. And you really have to have a balanced medical team. I think you have to have a lot of nurses, but I'm a huge advocate for nursing. I think that nurses often are the people who can communicate much more effectively with families who are doing the long-term care. And again, in a lot of countries, they don't have hospitals. They don't have, elaborate systems like we have. It's somebody goes home and the family's taking care of them. Nurses are so much more adept in understanding the day in, day out. How do you wash the patient? How do you treat the wound? What kind of food would be appropriate? Any of those kinds of things I think are really important. But I think probably, to me, the most important thing with those kinds of missions is really having a deep sort of anthropological understanding of what is this culture that I'm going into, so that, number one, you don't insult the people, number two, you can really help them, and you're sensitive to what their needs are.
Right. That definitely makes a lot of sense. So in terms of the cultural sensitivity, what are metrics that people should be taking before, embarking on a medical trip, do you think?
What do you mean by metrics?
Like, what should people be like aware of? Like, how should they educate themselves? Because obviously, cultures are very, a lot of these are isolated communities. Like, how are you supposed to like understand so much about them?
Well, I mean, it's tricky. So again, my work, I do a lot of work with the American military, and they've actually hired anthropologists to be able to. That's one component of the training. It's just one. It's not the overall, but it's just one component. I think here at Dartmouth Hitchcock, I don't think we have any anthropologists working with our teams that have gone to Haiti, have gone to Africa. They've gone all these different places. But there tends to be just within the medical community itself, the training, along with medical training, is sort of an overall support system of understanding where you're going. We tend to have a highly motivated group here who will do sort of a deep dive on their own to understand the culture. But for just kind of the general group, unnamed, who's going to an indigenous population, there really should be some kind of training that's done, that has historical context, anthropological, religious context, all of those, political, I mean, more than anything, there should be a political awareness as well.
Cool. So I really wanted to go back to also what you were talking about, like, I think a lot of the issues you brought up have been with women. And, like, the fact that women can't get undressed or something, and, like, they need to have their husband there. Given a point, like, just in, like, theoretically, I can see there being conflicts with that. Like, if there's like a illness that she doesn't want her husband to know about, or if the husband doesn't want her to go to the clinic, like, how do you resolve situations like that from, like, a medical perspective?
Yeah, and that's really tough because physicians are not really trained on the ethical components of that type of thing. They're trained on the ethics of, do we give another round of chemo to a terminally? I mean, that's something they understand. But a woman, I'll give you an example. A woman was hit with shrapnel. She's an interpreter in Afghanistan, and she was hit. I mean, really seriously hit with shrapnel, and part of it had lodged in her chest, and they thought it had possibly hit her heart, and so the physicians rushed her into the little unit that they had. It was all men, and she immediately said no, 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 because if they had undressed her, her community and her husband in particular could have stoned her to death. I mean, that's a really serious complication.
Yeah.
They had no women to be able to assist her. The lead surgeon decided to just go ahead and do it because he could not in all good conscience let her die.
Right.
And so he just went ahead and did it. And then before she was discharged, he went to the village, talked to the husband with the interpreter.
Right.
And everybody within the village explained what had happened, that there was no other recourse. And thankfully it resolved, and the woman was not stoned to death. But that was just emotional maturity on the part of one physician who realized, rather than simply saying, "Oh, good, we saved her life, terrific, go home,"
right,
and then they would have killed her.
Right.
He really took it upon himself to understand I've got to go do something above and beyond the call of duty here to make sure that her safety is protected.
Yeah, that sounds like a really interesting story.
It is,
Yeah.
yeah. It was a really good one. I mean, there's some other well, those are different ones, but with the American military, I mean, you get all sorts of issues where they go into places where they're, they get people. These are huge ethical issues. So they go into some port, and it's a goodwill call, and so they're giving vaccinations and often deworming, and people will stand in line for hours in order to get their kids in. But then somebody comes in and they've got a kid with a cleft palate. They've got a kid with a club foot. They've got, you name it, and the kid has something. They don't have the resources. And what do you do? So here's a mom standing there. She's been standing for 4 hours in the sun, waiting to, get some kind of help for her child. So those are really tough calls.
Yeah, that sounds like definitely a lot of things you have to like think beyond thinking on your feet, definitely when you're in those situations. But and I do think a lot of what you've said about how people resolve these issues are based on just like common sense and really looking at your resources and taking stock from that.
But it's much more than common sense. So I think we put a lot of burden on the physicians at hand to be able to go more than, just the example I gave of the common sense would have been the physician saying, oh, phew, I made the right call, I saved this woman's life.
Right.
But there's something beyond common sense. It's sort of an emotional maturity and a sophistication to understand the context of the situation to say, we're going to have to do something a little bit more here than just saving somebody's life. Can you train for that? Not really, but you can help people to understand. If you're going into a situation that is really different than working in rural New Hampshire at Dartmouth-Hitchcock, where it's kind of everybody's sort of the same here, you give some background on understanding about culture and that sort of thing. And then, you get into very difficult issues about limited resources and should you even be there? Should you be imposing Western medicine on people who have, been living quite well for a long time? I think from a Western perspective, we say, well, actually, it wasn't quite well. It was, people die at a very early age, and there are simple things you can do that really alleviate suffering. And why shouldn't that be offered to people?
Right.
Other people will say it's being imposed upon them. I personally think it's being offered to them.
Right. That's fair. I think a lot of discussions about development are just like, well, we're offering them electricity and consumerism and materialism, but are all these things like good things really? Like why? Like in Bhutan, they measure like the happiness, like GDP or something like that. And there's been I feel like similar arguments made about this is a great segue to the second part, which is cross-cultural medicine, and the idea that well, they've been using these herbal, or haven't used anything and they've been happy with that. So why do they need these things? And does that breed psychological discontentment? That's something that we have to worry about.
But that's happened since the beginning of time. That you have, as soon as people start to travel, you just move to another village, and you get some kind of new idea, and of course that causes some discontent. People say, well, wait a minute, that isn't the way we've always done it. Well, maybe the way you've always done it is not going to bring about. Somebody may say, I'm happy living with my club foot because it's past bad karma that I'm working out, and that's just life. That's the way it is.
Right.
You have someone come in and say, I just want to offer you another idea that we can actually do a surgery and fix that foot for you.
Right.
I would say that, again, this could just be a paternalistic Western perspective that I'm imposing, but I think that's a good thing. So it may initially kind of butt up against their notion of how things have always been done, and a certain even resignation about the situation as it is. But we know that there are better ways to.
Right. I think from a healthcare perspective, it's hard to, really say that. Well, even if there's an option that we don't give it to you, it's not like there's a need that this needs to be done, but at least the option is there and you are aware of it.
And again, going back to, I think that Western medicine learns a lot by going into cultures where all of a sudden it's like, well, wait a minute, oh, well, maybe pills are not always the best answer. Maybe there is something about acupuncture or meditation or some kind of herbal intervention that is better than something kind of toxic.
Do you have any interesting issues you've ever encountered in terms of cross-cultural medicine or personal anecdotes?
No, I'm not a physician.
Right.
I really haven't.
That makes a lot of sense.
I think the biggest one, though, I'm really concerned with women's healthcare issues more than anything, and because it's so fraught with ethical complexity. So issues of birth control, consent. Consent is a really big one for me, and I just think it's really tough because a lot of women in repressive societies will say, I don't want to have to consent. My husband, I prefer my husband making decisions for me.
Right.
And there you really do get into sort of this emotional tussle over,
Yeah.
do I want to impose my will upon this woman and say, no, no, you really should make your own decision.
Right.
Where they say, this is my choice. I want to be in this position, covered head to toe in the hijab and
Right.
having my husband make every decision for me.
How do you reckon? Like, I've definitely run into this
It's
too,
tough.
just talking about like contraception and
Right.
those types of rights as well. And
Right.
we've had, like, talked a lot in class about that as well.
Yeah.
And like,
And I think it has to be done extremely diplomatically and very, to use a non-medical term, very lovingly to a person to say, I just want to explain to you that, these are options that are available, but not to impose it upon someone. But they're really tough. I mean, you're going to go and meet with Professor Green. I was just talking to him yesterday.
Right.
He's been invited to Iran, and his wife won't go because you have to wear, I mean, this is not just like a scarf around your head. Women
Right.
have to
Yeah,
be
I know.
completely.
Yeah.
And I said, I totally agree with that. I mean, if people want to do it, fine. I wouldn't.
Yeah.
I refuse to do it.
Yeah. All right. I think that's about the extent of my questions. But you don't have anything to add about? Oh, I guess one more I can ask is like, there's programs like MedLife, and I'm not really super aware of like what is involved in that, but it seems like they involve like a lot of undergraduate students, actually, not medical professionals, engaging in these like community like health trips.
Yeah.
And I'm wondering like what possible ethical issues do you see arising from that?
Well, probably the biggest one that comes to mind immediately is for a population that doesn't understand that a student is a student, that they're not a medical professional. Could be problematic. That they could, and people can just make mistakes if
Right.
they're not trained in the area.
Right.
But again, I think and then there's also just the dignity issue.
Right.
That a 19-year-old kid kind of coming in and into a poor village. I mean, I've done that. You go to Africa and it's like you're looking at people and you can't help but feel really separate from them, but they're looking at you like you have all the answers in the world, and you think, I don't really have a lot more answers than you do, and you don't want to be paternalistic, you don't want to impose your will upon them. So I think it's tough for young students to kind of understand how do you walk that fine line, and again, preserving the dignity of the people that you're there to ostensibly to help.
Absolutely. Any like last words on either of these subjects? Or thank you. That was super informative. That was really helpful.
Yeah, it's great.
All right.